Welcome from Caregiver Cloud to our course on supporting family members. Providing support for family members is the responsibility of all healthcare providers. As a caregiver working in a close relationship with family members, you are in a position to offer ongoing support while caring for the client. The professional caregiver can support family members by showing respect and consideration. This is important because family members have the most information about the client. When the professional caregiver enters the home care setting, the family has usually been providing care for the client. Besides knowing their family member's personality better than anyone else, the family can also have a rich knowledge of the medical history and treatment. The professional care provider can learn much from the family, allowing for a smooth transition to home health, as well as maintaining what methods are already successfully in place. With respectful partnering, the client benefits from the unique expertise of both the family and the professional. Respect and consideration also acknowledge and reinforce the family's vital contribution to caring for their family member. With proper communication and coordination with the family, the home care provider can give better care to the client because the care is organized, efficient, and more client-centered. When family members are included in communication and coordination of client care, they feel supported by the care provider. The family's observations and comments are validated, and they can be reassured that the caregiver has their family member's best interest in mind. Duties and tasks can be organized and timed to fit with family plans or schedules. Duplication of care can be avoided, and client care becomes more efficient and effective. One of the best ways the professional caregiver can demonstrate support for family members is by being reliable. A way to show reliability is to come to work on time every day. In order to feel supported, family members must be able to depend on the caregiver. Family members won't be able to trust that their loved one is receiving good care until they know that the care provider is responsible and reliable. Demonstrating reliability is a matter of being on time, dressed appropriately, and ready to do the job. Following the care plan and schedule, providing excellent care, and showing interest in the client will allow the family to return to a routine. The family will feel confident in their choice to use home health care for their loved one. A method that can help the client and the family feel engaged and supported regarding care involves including them in discussions about the best course of action. When circumstances regarding client care change or need to be addressed, the caregiver can recommend that the family be part of the collaborative decision-making. Collaborative decision-making is a team approach to determine the best course of action for the client. By sharing information and ideas, the relationship between the healthcare professionals and the family can grow stronger. As the direct caregiver, you may be the first to see the opportunity for this type of communication. A family member tells you she was online researching the client's condition. Now she'd like to find a support group to join. You can tell the family member that you will contact the agency's social worker. As you become familiar with the client and family, you may be asked about the client's condition, prognosis, or for information about coping with caregiving and the situation. As the caregiver, you are not qualified to discuss all aspects of medical care or topics that are appropriate for a social worker or mental health professional. However, it is within the scope of your duties to offer to link the family member with agency resources who can provide services. As a main hands-on caregiver, you have the opportunity to observe the family and offer real-time support as needed. The caregiver can also document and report support measures. Because the professional caregiver serves as the eyes and ears of the agency, appropriate care can be provided to both the client and to the family. Support measures do not include crossing professional boundaries such as performing duties outside the scope of the job. Secondary clients is the term used for family members who are overworked, stressed, and neglecting their own needs. If family members can't keep up with the challenges of caregiving or are unprepared for the constant task, they are at risk for harming their own health and safety. Sometimes family members are called hidden patients because they require medical attention of their own. The care provider and all agency providers should be watching for family members who require extensive support so that proper resources and guidance can be given. Research shows that without support and attention, family members who are caregivers can suffer serious physical and mental health consequences. Poor health, hospitalization, sleep disturbances, lower immune function, abnormal lab results, and premature death have been reported if family members are the primary caregivers. The burden of caring for a loved one can also lead to behaviors such as substance abuse or use of prescription drugs. Even trying to maintain a simple work-home balance becomes difficult for family members because of schedule issues or being alert for nighttime needs. Depression is a common condition for family members who are caregivers. Studies have shown that support helps people withstand difficult circumstances and prevents feelings of isolation and loneliness. Friends and neighbors often withdraw for various reasons. Sometimes they get tired of hearing about your situation. Friends and neighbors are fearful of their own vulnerability, or they feel guilty for their own well-being. Finding caring friends may happen through support groups. Even with support, some family members may experience secondhand stress or burnout. One of the key signs the caregiver may observe is a family member with an angry or sad disposition. Burnout is a combination of physical and emotional exhaustion that can become overwhelming. Even with support, some family members may become depressed or overreact to everything around them. As the hands-on caregiver, you should report observations to the client's case manager for possible intervention. This concludes the Caregiver Cloud course on supporting family members. Copyright 2016, all rights reserved, Caregiver Cloud, LLC.